Good morning, everyone. This is Meghin Delaney in Governor Steve Sisolak's office. Thank you for joining us today. We will get started right at 10. I'm going to set this broadcast over to YouTube, and once I am sure we are on YouTube, I'll introduce the governor. As a reminder, if you could please stay muted, keep your microphone off, and if you want to keep the camera on or off, that doesn't matter as much as your microphone to me. But we will have time for Q&A at the end. So I am going to take us live on YouTube. Give me just a second, and then we'll get started with the governor. All right, thank you everyone for your patience. It is 10 a.m. We are live streaming on YouTube. Thank you all for being here. As a final reminder, please keep your microphone muted through the duration of the press conference. The governor will take Q&A at the end. And at this time, I'll ask the governor to turn his microphone and camera on, and he'll be able to get us started.
Hi all, if you have your camera on, could you please turn it off? Mic's off, camera's off. Thank you so much.
Ready to start? Got me unmuted?
Yep. Ready when you are, Gov.
Good morning, everyone. Thank you all for being here this morning. I wanted to take a moment to update you on where we are with the status of COVID-19 in our communities. We have seen a rapid decline in case numbers, coupled with declining hospitalizations, a drop in COVID-19 detected in wastewater, and a broader availability of testing and an increase in available treatments. We reported our first Omicron case 2 months ago. Nevada recorded our single highest day of new cases on January 10th, with 7,865 cases. We're currently averaging around 1,280 cases per day. Approximately 800 fewer people were hospitalized in Nevada yesterday with COVID-19 than were hospitalized at the peak of the Omicron surge. During the Omicron surge, fewer than 0.01% of Nevadans required critical care hospitalization on any given day. More than 2/3 of Nevadans aged 5 and older have made the choice to get vaccinated. I continue and urge all eligible Nevadans to get vaccinated and boosted against COVID-19. Last week, our first order of 600,000 at-home COVID-19 test kits began arriving in the state. Nevadans are now able to pick up these test kits and have them in their homes to use at their convenience. This is in addition to tests the federal government is mailing to homes, ongoing testing clinics at community sites around the state, and the option to be reimbursed by insurance companies for at-home test kits. If you feel sick, I encourage you to stay home, avoid contact with others, and take advantage of these testing options. We also launched a treatment center this week in Las Vegas, and a site in northern Nevada will open next week. We are using $19 million in federal dollars to fund these programs to make sure Nevadans who do get sick have access to treatments free of charge. We have continued to work with the Nevada Hospital Association to increase our ability to serve patients who need care in a medical facility or a hospital setting. Yesterday, the Legislative Interim Finance Committee approved more than $20 million in funding to strengthen the nursing apprenticeship program. This money will go towards helping pay nursing students working in facilities, provides travel stipends for students traveling to rural Nevada, and provides stipends for students who complete their schooling and agree to work at a qualifying facility for a specific duration of time. I cannot express my gratitude enough to all the frontline workers, particularly those in our healthcare settings, who have continued to provide care to Nevadans throughout this pandemic. To the Nevadans and travelers that have done the right thing, gotten vaccinated, stayed diligent, and protected each other for the last 2 years, from the bottom of my heart, thank you. All of us have had to sacrifice and deal with hardship during an unprecedented time. Despite that, students, teachers, moms, and dads have worked tirelessly to return to a sense of normalcy. Workers have remained on the front lines and have taken the appropriate steps to keep their coworkers and their communities safe. Given all of these updates and the tools that we now have, now is the appropriate time for me to announce that Nevada will rescind our mask mandate, effective immediately. Masks will no longer be required in public places, but there are still locations where you may be asked to wear a mask. Masks and protective equipment requirements in facilities serving vulnerable populations like hospitals, clinics, and long-term care facilities will be overseen at the direction of the Department of Health and Human Services. The safety of healthcare staff and patients are our top priority. Also, federally, masks are still mandated in airports, on planes, and on public buses and school buses. Teachers in schools will no longer be required to wear masks, but school districts will need to work with their local health authorities to have plans in place to deal with an outbreak. And while this goes into effect immediately, I don't want schools to be disrupted today. So masks will stay on through the rest of this school day so parents and families can have that conversation together. Let me be clear. The state will no longer require masks in public places, but employers and school and organizations, including school districts, may set their own policies. And I encourage them to work with their employees and communities to ensure that policies are in place. I expect all our employers to respect the individual decision of employees who make the choice to keep their mask on. Just like vaccines, masks are a great tool that we have at our disposal. I expect going forward to still see Nevadans and visitors occasionally utilizing masks when they are out in public. That may be because they are immunocompromised and want to protect themselves. They may care for someone who's immunocompromised or live with a young child at home who cannot yet be vaccinated or simply prefer to wear a mask. There will be times moving forward and going forward when I will still wear a mask because I want to protect my fellow Nevadans, like when I visit my 95-year-old mom, for example. And if an organization or business establishment has a mask policy in place, of course, I'm going to abide by that policy. I hope that in this moment, and as we move forward, we can remember and to continue to lead with kindness and to treat our fellow Nevadans and visitors how we would like to be treated. I want kindness to be just as contagious as COVID is. COVID-19 has brought out the best and the worst in society. And I'm always proud to be a Nevadan and to see the way Nevadans take care of one another. We are at this point now because as Nevadans, we always look out for one another. That's our battle-born spirit, and that's the Nevada way. It's my honor to serve as your governor and to be able to work on your behalf. I will now be able to take some questions. Thank you for joining me today.
Thank you, Governor. We will use the raise hand feature. I see your hands coming up, so you guys are all very familiar with that. We'll go to Sophia for the first question and then Mary.
Hi, Governor. Sophia Perricone with Fox 5 here. My question for you is, what do you say to the doctors who say we're not ready for this step yet?
There's a wide divergent opinion on this. Some people think that we were ready long ago. Some people we think we're not ready yet. Everyone is entitled and has a opinion on the subject. I have to make the decision and balancing all the factors and all the data that have been presented to me. I feel that now is the appropriate time to move forward.
Thank you. We'll go to Mary Hines for the next question and then Jaclyn Schultz on deck.
Thank you. Hello, Governor.
Hi, Mary.
Nevada's mask mandate has been tied to the CDC's guidance. That is, that masks should remain required as long as disease transmission remains high. Disease transmission, though declining, remains high. So what is the science behind dropping the mandate?
Well, the CDC guidelines were put in place prior to Delta, and that was as related to Delta variant. Now we're dealing with the Omicron variant, which is much more transmissible, much more contagious, but not as severe and doesn't require the same number of hospitalizations. I'm basing this on the statistics that I mentioned earlier, the precipitous drop in positive cases, the considerable drop in hospitalizations, and the wastewater testing that shows that we're on a trend moving downward.
One follow-up, if I may. Our hospitals remain under considerable strain. Staffing shortages are at crisis levels. Are you at all concerned that dropping the mask mandate, which was in effect to limit disease transmission, will result in more cases and put additional strain on our hospitals?
Well, I'm hopeful that we'll continue the downward trend. That's why we're removing the mask mandate. I want to again compliment our frontline healthcare workers. They have done an absolutely incredible job dealing with this. And I thank them for that. We're eternally indebted to them for doing that. But I'm hopeful that this will not cause an increase in hospitalizations as we move forward.
Thanks, Mary. We'll go to Jaclyn Schultz for the next question, and then Brian after Jaclyn.
What's your hopes for this in terms of economic recovery for businesses?
Well, we've put businesses, through a lot in the last 2 years, clearly. It's my hope that this will, one, increase business for the businesses that are going to, decide to remove a mask mandate. They think it's going to attract more people. I'm hopeful that it will help on our employment situation, that some people have not gone back to work because of the mask mandate, and that they will go back to work as a result of the mask mandate being eliminated. So the economy has come back tremendously. You've seen it in our gaming numbers. We've had over $1 billion a month, I think 10 months in a row now. And they continue to move forward under the leadership of Control Board Chairman Bryn Gibson and Commission Chairman Tagliati as well. So I'm hopeful that businesses will continue to prosper and small businesses will continue their recovery.
Thanks, Jaclyn. We'll go to Brian for the next question, and we'll take Victor after that one.
Morning there, Governor. Quick little question. The CDC director did just speak this week to the states that were dropping their mask mandate, saying right now is not the time. And this is regarding the Omicron variant. Can you respond to that, as well as what would happen if the next variant comes out? Where would we stand with re-implementing possible mask mandates?
Well, and I respect the CDC and the information that they've provided us moving forward, and they go by on a national basis. Every state is different. I've analyzed data particularly focused on Nevada and how we're moving forward. Never say never. I'm hopeful that there won't be another variant or a more severe variant coming forward, and Omicron is becoming more under control. So I'm hopeful and confident, based on the data that we have, that we're in a good position to drop this, to give people back some freedom. Everyone wants to get back to their normal life, whatever normal is. I mean, it's been 2 years. So I think the time has come, and I'm confident that we've analyzed the appropriate data and we've made the right decision.
Thanks, Brian. We'll go to Victor for the next question, and Christian after that.
Thank you, Governor. Victor Jakes with the Review Journal. As you know, you reimposed the mask mandate in July, but Nevada had a huge spike in coronavirus cases from Omicron, just like every other state in the country. As you just said, our highest daily case count came in January. My question is, what evidence is there that the mask mandate did anything to reduce case counts?
Well, if you're looking for definitive evidence, people are going to claim things on both sides of that, Victor. I go based on my medical advisory team. It's obvious that we have had a precipitous drop in the number of cases. It's attributed to something. I think masks had a significant part of that. Was it the only thing that happened? No. I think vaccination increases have also helped on that. And, people being more conscious of exactly what's happening. And I think now is the time that the general public, our students, our teachers, will be able to go on with their lives in a little freer setting and be able to get back to what we call normal.
Thank you. If I could, just one follow-up. You've talked about all these great tools. Obviously, the vaccinations are very effective. We've got tests coming into the state. Is it time to just say that the emergency is over and just start winding down any other emergency directives that are in place?
I want to be clear, Victor, the emergency is not over. The pandemic is not over. We're still getting far too many cases, far too many hospitalizations, and far too many deaths. Hopefully, as vaccinations continue to become more widespread, people take advantage of them, we'll have those rates continuing to decline. And then we'll be able to remove more restrictions. But right now, I think this is a major step moving forward for people. I think that students and parents have been clamoring for this for a long time. Our businesses have been asking for this. Our population has. And like I say, in consultation with my team and our medical professionals, I think it's the appropriate time.
Thanks, Victor. We'll go to the next question. We'll go to Christian and then Ben Deck. Victor, could you remute your microphone so we don't get any feedback, please? Thank you. Go ahead, Christian.
Good morning, Governor. This is Christian with 8 News Now here in Las Vegas. Any concerns about rolling back this mandate at the school level? We know that so many students are, the young population, they're still getting vaccinated. This process is still underway. It's not done. Any concerns about that?
Well, there's always a concern on rolling back a mandate. It's a concern for everyone. I'm hopeful that as time goes by, more and more young folks will get the vaccination. It's my hope that they're going to want to be protected. And like I said, I encourage people, if they feel more comfortable to wear a mask, continuing to wear a mask, they should do so. And if somebody that's at a job or a teacher wants to continue wearing a mask, they should do so. If students in consultation with their parents decide they should wear a mask in school, they should be allowed to do that and free from criticism for doing that as well.
Thank you, Christian. We'll go to Ben and then Jackie for the next question.
Governor, it's Ben Margiott with News 4 up in Reno. What do you say to the Republicans who are already criticizing you for this being, they call it a political decision, especially since all or almost all Nevada counties are still in high or substantial transmission. And they say that this is not based on the science as you have promised to act in the past.
Well, it is based on science, and I gave you the statistics that we based it on. All these political operative potential opponents have an opinion. I understand they have an opinion. I have to make the decision. I have to make the decision based on the best information that is brought forward to me and that we've accumulated. They don't have access to this. I balance all of the interests at hand, the medical information, the business information that's coming forward, the opinions that people have expressed as it relates to this, and make a decision based on that. If they want to make a decision or a comment to spur their fundraising or to do whatever, I'll leave that up to them. But I'm doing what I think is best to protect the health and welfare of the residents of the state of Nevada. I will continue to do that, and mine is based on science, not politics.
Thanks, Ben. We'll go to Jackie for the next question and then Yvette after that.
Hi, Governor. I have a question about schools. You mentioned that employers, including school districts, could set their own policies if they so desire. So does that mean that for schools in particular, masks are not required for teachers and students until such a time that perhaps a school board would make that decision?
No, it means that masks are not required for students and teachers and employees starting tomorrow morning. Everything else is effective immediately as of now. I've already signed the executive order in this regard, but these students are in school right now, and a lot of these civics classes watch these press conferences, so I didn't want them ripping off the masks in the middle of the day. I want to give them the chance to go home, talk to their parents, have that discussion, and in consultation with their families, decide what's best for them. Now, if a particular school board wants to go further, or a particular business wants to go further than my directive has, and require masks and various things, they're entitled to do that. And I respect that decision. But this is a statewide directive.
My follow-up question had to do with the CDC guidance, which was formerly binding in Nevada. How does this announcement today affect that?
Well, part of the executive order is we're removing the CDC guidance as being binding. Like I say, the CDC guidance was put in place basically under Delta when it was a lot different variant than we're dealing with Omicron. Things have changed and you have to balance everything. And that's what I've done. And regardless of any decision I make, people are saying you did it too soon, you did it too late. I get that. Everybody's entitled to an opinion. Everybody has an opinion. I have to make the decision. I can't let everybody just make a decision individually until today. Now they can make a decision whether or not they want to wear a mask. And it's up to an individual to decide to do that. And again, I want to stress, a lot of people are going to continue to wear a mask, and I fully understand that. And I encourage them to do so if that makes them feel better and makes them feel more secure. And I ask everyone to be respectful and kind when it comes to other people's decision as it relates to mask wearing.
Thanks, Jackie. We'll go to the next question for Yvette.
Thank you, Governor. Going back to the CDC question, what they have said the last couple of days, is this move by governors in several different states a rejection of the CDC guidelines? And also, does this add to the public confusion because of the lack of uniformity on a national basis?
Well, I think there's always been confusion because we have every state has its own policy as it relates, as opposed to a national policy as it relates to all of these issues: social distancing, capacity limits, mask wearing, vaccinations, whatever it might be. Every governor is charged with making those decisions, and I'm in contact with our governors. I just got back from a National Governors Association meeting. I believe every governor is doing what they think is best. I'm doing what I think is best based on the citizens of the state of Nevada, and that's what I've used to make my decision. Our economy is different than other states. Our vaccination rates are different than other states, and those are things that we all have to take into consideration.
So then are we rejecting the CDC's guidelines?
No, we're not rejecting the CDC's guidelines. That was part of what we took into consideration in establishing this policy. My team and I sat down, we discussed the CDC guidelines, but we determined that in the state of Nevada right now, today, we feel that this is the appropriate time.
Thanks, Yvette. Thanks, Governor. We'll go through a few more questions. I'm going to try to get to folks who haven't been able to ask a question yet. So we'll go to Joe. And Joe, I think you said your mic might not be working, so we'll see. Give it a try. Okay, Joe, we can't hear you, so I think you said Sophia could ask your question for you. So sorry, Governor, we're going to go to Sophia instead of Joe.
Hi, thank you. The question is, what impact do you think masks have had in slowing the spread of COVID?
I think that they're one of the tools that we use to slow the spread of COVID. The biggest tool that we use to slow the spread of COVID, and the most effective tool we use, is vaccinations. And I encourage everyone to continue to get vaccinated if you've not already done so, to get boosted if you've not already done so. But there comes a time where you have to weigh the benefits of the masks versus the difficulties or the downside of wearing a mask. And today is the day that we've decided that the scale tilts and we're going to remove the mask mandate.
And then as a follow-up, if masks have worked, some people might be asking why not keep them for a bit longer?
Well, a bit longer is a pretty subjective term. You know, I don't know how long a bit longer is. Is a bit longer a day? Is it a week? Is it a year? If you had masks on permanently, you know, we'd have a slow and spread of flu and colds. But there comes a time that people will make their own decision and do what they feel is in their best interest. And I think that this is the time. I still encourage people, if they feel that they're safer or they're immunocompromised or they have a family member that is, keep wearing your mask. If you're feeling not up to par, you're feeling sick, stay home. Don't go out to dinner. Don't go to work and see your friends at night. Stay home and prevent the spread of the virus.
Thank you. We'll go to the next question, Gov. We're going to prioritize folks who haven't had a question yet. So we'll do Abel and then Michael.
Governor Sisolak, good morning. Question for you here is, for those business and establishments who choose not to follow this mandate and remove that mask mandate, how are they going to be protected against those individuals who may want to still enter their business without a mask on?
Well, we can't have any legislative or executive order to protect them, but they've had to deal with the same thing now with people that want to go into these establishments not wearing a mask. How do I protect them? I am asking, and I mean this with all sincerity, that we need courtesy and kindness and respect to be just as contagious as the virus is. I understand there's a group of people that don't want to wear masks. I get that. I respect that decision. But I ask those people also respect the decision of those individuals that want to wear a mask for whatever the reason might be. They might want to do it just because they feel safer that way. And I was asked them to respect their right to do that. And if a business owner feels that it's in their best interest of protecting their employees and their customers by not removing the mandate, by continuing the mandate, they are entitled to do that. And I encourage them to make that decision by taking into account, their employees' feelings, their feelings, and the customers, and make their decision that's appropriate.
Thank you. We'll go to Michael for the next question, and then we'll take Jeff.
Thanks, Governor. Just to clarify, for vulnerable populations, does that mean that mask mandates are still going on in correctional facilities?
As it relates to correctional facilities, there is not going to be a mask mandate. If we have inmates or we have staff that choose to continue to wear a mask, they will be directed the same way. They're allowed to continue to wear that mask. But they won't be mandated totally to wear masks.
Thank you. We'll go to Jeff Gillan for the next question.
Morning, Governor. Wanted to make sure that I understand something correctly, sir. School districts, for example, if I'm a school district and I want to continue the mask mandate under this new directive, they can continue to do that, correct?
Correct.
Okay. Do you reserve the right to reimpose a mask mandate if somehow the situation gets worse again?
Well, I don't want to say never, because never, isn't really reasonable. I mean, Tom Brady this week said, don't ever say never, because he didn't retire, retired. Now he's talking about maybe not retiring. I don't know what's coming down the line. I don't know what's going to happen in a week or in a month or 6 months for that matter. There could be another strain, God forbid, that comes along that's worse, and we might have to reinstitute some mandates and some different policies. But the decision is based on the information and the circumstances that we're facing right now. And that's why it's made that way.
Thank you.
Certainly.
So we have two more first questions, and we'll go to Lucia Starbuck and then, Feven from 5. I pronounced that wrong, I'm sure.
Hi, Governor. I was wondering if what you have to say to immunocompromised Nevadans, folks who are at high risk now that the mask mandate has been removed.
I guess the best thing I can say to them is I hope that they continue to wear their masks, and they should encourage those that are directly around them, and the friends and family that they have should also be encouraged to wear the mask. But for the general population, it's up to them to make that determination. But for the immunocompromised, they should not feel self-conscious. They should not feel they're going to be criticized. They should wear a mask if they want to wear the mask.
Thanks, Governor. And we'll take one last question from Fox 5.
Good morning, Governor. Unlike our friends to the west in California, Nevada's mask mandate applies to, or the lack thereof a mask mandate will apply to all people, not just the vaccinated. What went into that thought to not only allow those who are vaccinated to go unmasked?
Well, we've been at this a long time, and we've had vaccines and boosters available for everyone for more percentage, and we can debate what that percentage is. That's not going to get the vaccine. I get that. I totally understand that. And I don't want to hold the entire society back or the entire economy back as a result of some people that, whatever their reasoning is, and people are entitled to have their own reasons for whatever they want to do, don't want to get the vaccine to not implement this mandate. And I don't want to put people in a position where there's this, whatever you're calling it, a check, a vaccine passport, whatever it might be, that we're going to have our frontline workers having to ask people, have you been vaccinated? Prove to me that you've been vaccinated. I think that's unfair to ask of people. So we're doing this. If you want to go get a vaccine today, there's vaccines available, but you don't have to wear a mask effective now.
Thank you, Governor. And as Governor mentioned, we'll have the emergency directive out after this. So Governor, if you have any closing comments at this time, those were the questions we got through.
No, I appreciate everyone taking the time and getting the information out there to the general public about where we stand. I want to thank all Nevadans that have worked so hard to get us to this point today. We've got a lot of tools that we can have at our disposal that I ask you to continue to use. We have vaccinations. We have masks still available if you want to use it. We have treatments that are set up for those that are do come down with the virus and they want to take advantage of that. But I ask everybody to please be considerate. I know that there are going to be people that are going to be pleased and displeased. I get that as part of the job that I'm assigned to do, and we do that to the best of my ability. My staff has been absolutely incredible in terms of helping me get to the decisions we needed to get to. Our medical advisory team has been phenomenal. But I ask you to take away from here, please be as considerate and as kind as you can possibly be to other people, people that are choosing to still exercise their right to wear a mask. Show them the respect that you want to be shown. It's unfortunate we've had so many instances of people becoming visibly irate and upset and attacking people, and we have no room for that in Nevada or in our society for that matter. So with that, I encourage everybody to continue to follow your conscience, treat people as best you can. And we're not through this pandemic. We're still fighting it every single day, but I think we're taking another step forward. And I thank all the folks in the state of Nevada for making this possible. So thank you all very much. Have a nice day and God bless you all.
Thanks, Governor. Thank you, everyone.